Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order and you can make use of it for the continuous study. Thank you very much. So we will continue with the short stature and today we will have height velocity. We will have some discussion on height velocity and its pitfalls, whether it's pathological, physiological and all those things. So first of all, you understand what you mean by height velocity. Okay, what you mean by height velocity. So height velocity, first how to calculate this. Now, height velocity, how to calculate this? Now here, we need actually one more thing. What is that? We actually need one more step for the step of body proportions here. Okay, body proportions, yes. So because our body is divided into upper segment and lower segment. Upper segment means it is starting from crown to the pubic symphysis. Okay, and lower segment means from the pubic symphysis to the floor or tip of the toe. So now, in the first year, the upper segment and lower segment grow on the same pace. Okay, whereas 5 years to puberty, if you look into upper segment 1/3 and lower segment is 2/3 will contribute to the height gain. That means 5 years to puberty, 1/3 portion of the upper segment and 2/3 portion of the lower segment will contribute to the total height gain. That means longer bones like femur etc. there will be there in the lower limbs. So that's the reason why it contributes more. Puberty to maturity, if you see, upper segment contribute about 2 to 3 parts, and as lower segment 1/3 part will contribute to the height gain. Okay, and what we see in test is at the time of the birth the difference is 1.7 is to 1.7. Then the ratio is 1.7 and in 3 years it is 1.3. At 9 years the ratio is 0.9 to 1. So this is actually what we see. Now this is the Indian data for this particular upper segment lower segment ratio. Okay, for the boys and girls it is given. Now the difference. So there are some inter-regional differences in this short stature now. North Indian boys and Central Indian girls were found to be taller and heavier. Northern side people will have longer trunk while southern side people will have longer limbs. So this is inter-regional differences. North and West Indian people, west part of the Indian people. So there's a curve. And so these are some of the important points. Now come to the actual point, the proportionate and as well as disproportionate short stature. So this is a new things. So depending upon the upper segment and lower segment, we are again dividing the short stature into two things. So far we have divided short stature into only 3 points: familial, constitutional, pathological, endocrinal, etc. Now we are dividing, suppose a patient of short stature is there, now decide whether it is proportionate or disproportionate. Short stature due to systemic disorders, we are always proportionate short stature will be seen, as we seen in some of the chronic disorders, endocrinopathies, etc. Disproportionate short statures, so this was found out by marking the proportion of the charts. This contains sitting height and subischal leg height, SIL. Okay, so when the disproportion between the SIL and the sitting length is more than 2 SD, then we will usually call it as a disproportionate short stature. So upper segment is more than the lower segment. That means limbs are affected more. Now when I say disproportionate short stature, it may be again two possibilities. Whereas upper segment is more than, anyway it is a short stature, but upper disproportionate. Proportionate, it's not proportionate, disproportionate. So where one condition upper segment is more than the lower segment, another condition is lower segment is more than the upper segment. Okay, upper segment is more than the lower segment. So this is usually seen in case of skeletal dysplasia. Whereas lower segment is more than the upper segment, that is usually seen in case of some of the storage disorders like mucopolysaccharidosis, etc. MPS. Now come to the pathological short stature. If the child is having any obviously some syndromes, okay, so we know by seeing the child, isn't it? Suppose the child is syndromic child may have short stature. So this will be identified by looking at the child, because by looking at the dysmorphic features you can identify. Okay, and if the weight is not affected, this can be seen in case of Down syndrome, Turner syndrome girl. Usually a Turner syndrome child with the short stature will be there, although she is not showing any presentation like shielded chest, short neck, etc. So we need to go for the carotid. See, any female child coming with a short stature, always you first suspect about Turner syndrome. That is must and should. Okay, so that's the rule. Okay, so then Sock syndrome, then Silver-Russell syndrome. This is one more important thing. Prader-Willi syndrome. Okay, Prader-Willi syndrome, there will be abnormal development of the Prader-Willi, abnormal development will be there. Actually, what happens in Prader-Willi syndrome is, in the first year of the life, the child is actually failed to gain the weight. Okay, child will have some malnutrition or failure to gain the weight, etc. will be there. But during the second year, they will have hyperplasia and they become obese. 2 साल के बाद वो suddenly obese हो जाता है. ठीक है, शुरू में जो है वो थोड़ा ठीक ठाक रहता है या कम रहता है उसका weight. That's a very typical of Prader-Willi syndrome. Now divide the other causes of the short stature into proportionate and disproportionate. Now if you look into the proportionate short stature, chronic systemic disorders and endocrine disorders, and some of the endocrine disorders, if you look into that, if the weight for the height is normal or obese, then endocrine disorders. Growth hormone deficiency, where you find the history of head trauma or injury to the pituitary gland, etc. Cushing's disease, hypothyroidism, etc. These are some of the endocrine disorders where you will find the short stature of endocrinal variety. Chronic systemic disorders, when you suspect if the height for the if the weight for the height is reduced. Okay, chronic systemic disorders, malnutrition, inflammatory bowel disease, celiac disease, cardiac failure, cystic fibrosis, renal problems, especially very important. Okay, congenital heart disorders, primary immunodeficiencies, renal disorders, very important. Okay, chronic renal disease, renal tubular acidosis, etc. Juvenile idiopathic arthritis, malignancy, and some of the psychosocial deprivation. Now coming to the disproportionate short stature, and this is a condition with the short stature but the length of the upper limb and lower limb are not same. Disproportionate का meaning ही वही है. The length of the upper limb and lower limb is not same. If the upper segment is more than the lower segment, okay, upper segment is more than the lower segment, so usually we will have some of the important causes. So upper segment का जो segment is more than the lower segment, so definitely लोअर सेगमेंट लोअर सेगमेंट क्यों छोटा हो गया? लोअर लिम्स का प्रॉब्लम हुआ. लोअर सेगमेंट इसलिए छोटा हो गया कि लोअर लिम्स का ग्रोथ में प्रॉब्लम हुआ. सो डिसऑर्डर्स अफेक्टिंग द लिम्स, सो दे आर द मेजर थिंग्स. ओके, इट मे बी बिकॉज ऑफ अकेंड्रोप्लासिया. अकेंड्रोप्लासिया इज वन ऑफ द मोस्ट कॉमन कंडीशन. देन रिकेट्स, ओके, हाइपोकॉन्ड्रोप्लेसिया, ऑन्टोजेनेसिस इम्परफेक्टा, genetic issues. Okay, these are some of the conditions where upper segment is more, lower segment is very less, achondroplasia, etc. If the upper segment is shorter and lower segment is longer comparatively, then usually this is because of the disorder of the trunk portion, vertebra, और वहाँ पे problem हुआ, इसलिए upper limb का upper segment का height नहीं बढ़ा. Disorders of the trunk, then dysplasias, the different types of dysplasia. Very important is mucopolysaccharidosis. Okay, upper segment is shorter and lower segment shorter than the lower limbs. Mucopolysaccharidosis, carry spine, tuberculosis of the spine हो गया और वहाँ पे fracture हो गया उसके बाद. Then skeletal dysplasias. Okay, so this is the basics of a short stature, especially the proportionate and disproportionate type. Thank you very much. In the next class, we will see assessment of the short stature, how we have to proceed systematically. Thank you very much.